There's a new study that shows who's getting hit hard by the virus in Georgia. Researchers say race and rural areas are key factors. Here's News Channel 6's Devin Johnson.
A research study conducted by epidemiologists from the Medical College of Georgia shows that COVID-19 is impacting certain races at a higher rate in rural parts of Georgia than in other counties in the state.
What we saw from our first research report was that rural parts of Georgia and communities that had a high proportion of African Americans had the highest incidence and mortality rates.
There are 159 counties in Georgia. 120 are compromised of rural areas. These counties have been identified as hotspots for COVID-19. Dr. Justin Moore says he and his colleagues discovered counties that have a population of 50% of African Americans had a 30% increase to be infected by the virus. Those counties also had a 70% increase to die from the virus.
That's basically saying comparing counties that had a lot more African Americans, right, more than 50% African Americans living there, compared to counties that had less than 50%, we saw a higher mortality rate. That people were more likely to die in these counties.
Dr. Moore says these counties are no stranger to diseases like stroke, diabetes, and sepsis.
When you talk about disease and you talk about morbidity, these are communities that have been affected disproportionately. So if you get a new pandemic, what does that mean? All that means is that the same people are going to continue to hurt at the same rate, disproportionately speaking to the larger, population.
The study also shows rural Georgia counties have a lower number of intensive care beds, primary care physicians, and the lack of other resources. He says a combination of those factors and lower conditions where people live, learn, and work can overwhelm available health services.
If you don't have insurance, then what is your likelihood of actually going to a doctor? These are individuals who are more likely to kind of wait, to kind of see, let me go get some Robitussin or go get some type of over-the-counter drug. Maybe it'll go away.
Dr. Moore and his team are currently doing a data review to see if the clear disparities they saw early in the spread continue to hold. In Augusta, I'm Devin Johnson, WJBF, News Channel 6.